we are very pleased today to have really a distinguished group of speakers who will be sharing with us all their experiences, views, and perspective about the use, practical use of ICT to combat pandemics like the coronavirus, but also potential other future pandemics and emergencies. And we have made some great efforts to really bring some very diversified perspectives and solutions that are covering different areas of possible digital health interventions. However, before we start, I would really like to invite Mr. Sharafat, who is the chairman of the study group 2, to provide some introductory remarks. Mr. Sharafat, you have the floor, please.
Thank you very much, Hani. Good morning, good afternoon, and good evening to all of you around the globe. My name is Ahmad Sharafat. I'm the chair of ITUD Study Group 2 and professor of ECE at TMU. Considering the urgent need of to utilize all resources available to the world community in combating the COVID-19 pandemic, in the development sector in ITU, we have planned for a series of public webinars on the vital role of ICTs in mitigating the impact of COVID-19. As part of our work in ITUD Study Group 2, in addition to our webinar today, 2 more webinars are planned for July 14 and 15, both from 14 hours to 1540 Central European Time. I would like to begin our webinar today by welcoming the panelists and the participants to this webinar on new e-health solutions to combat pandemics with ICT. This webinar is part of our work and studies on question 2.2 in ITUD Study Group 2. Today we have 6 very distinguished expert panelists. They are Mr. Turhan Muluk and Mr. Mario Romao, both from Intel Corporation, Mr. Hirokazu Tashiro from NTT Data Corporation, Ms. Malina Jordanova from Bulgarian Academy of Science, Ms. Isao Nakajima from Seisei University in Japan, and Mr. Tepi Sakano from ALM Incorporated, also in Japan. Our moderator, of course, for today is Mr. Hani Iskander, Senior Coordinator, Digital Services, International Telecommunication Union in Geneva, Switzerland. Before ending my opening remarks, I would like to use this opportunity to invite you all to participate in our work and in our studies in ITUD Study Group 2. Ladies and gentlemen, without further delay, I invite Mr. Hani Iskander to begin moderating our webinar. The floor is yours, Hani.
Thank you, Mr. Sharafat, very much. And indeed, we truly believe that this webinar is very timely. I think we are all very much aware of the pressure that the COVID-19 outbreak has put on nations and community, particularly countries who have already pressure on the health system, and they really need to look at cost-efficient intervention that can really enable preventive and curative healthcare, particularly in significant resource and time constraints. And we have seen, this COVID is almost have been an opportunity to scale up digital health intervention in a number of areas. And we're gonna see some good examples, I think, today in terms of, how digital health has been used and how it can be used in the future. And also not only leveraging the traditional type of technologies, but also the new technologies, particularly 5Gs, artificial intelligence, IoT, big data, etc. So we are very excited to be able to kind of share experiences and really listen to top-notch experts in each of his or her own field. The digital health can be used, as you know, in many, many different ways, from simple preventive measures to help monitor the compliance with quarantine measures or exit strategies. We have seen contact tracing has been a big area of intervention, where we have seen for the first time really governments at the highest level really engaged in facilitating the deployment of such innovative apps to be able to trace contacts and really worked very hard to resolve all the regulatory privacy challenges that are associated with those types of applications. We have seen also telemedicine services, and also we have seen innovative applications in terms of use of AI and big data, particularly to process, for example, population mobility data to kind of predict and understand the spread and of infection using those types of tools. However, while we are seeing all those kind of very encouraging examples, I think we can all agree that challenges are still there that still need to be resolved. As I mentioned, there are still real concerns about the privacy and personal data security. Many countries are very keen to not to allow the digital innovations to be used within this particular context, to open the opportunity later on for significant risks on being able to keep our privacy, our identity, not to share where we are and where we go and who we meet, etc. And there has been some very good and innovative approaches on how we can solve those issues and really leverage the power of technology. So we are going to use this webinar to really hear for a number of use cases that touches upon different new e-health solutions, and we try to make to present different types of use cases, from mental health, from telemedicine, from diagnosis using AI, etc. So you're gonna see there is a lot of diversity, and I think we also asked our speakers and experts to share with us at least some of the main challenges that they have faced when they were deploying those types of solution, and what kind of measures that they have tried to deploy in order to make sure that those solutions will be used and scaled up in a safe manner. So without further ado, I would like to invite Mr. Turhan Muluk and Mario Romao from Intel, who are going to share with us a lot of insights from Intel on the use of AI and 5G for COVID-19. So Turhan and Mario, you have the floor, please.
Thank you, Hani, and hello, everyone. My name is Turhan Muluk. I am working for Intel Corporation, and I am also representing Intel at the ITU sector. First of all, I would like to thank ITU BDT, Dr. Sharafat, Professor Nakajima and his team for the invitation and organization of this very important webinar. In fact, my wife is a medical professor at the university, and I know very well how health workers are fighting for COVID-19 at the front line, and they need new technologies to combat with virus. Next slide, please. I and my colleague Mario will talk on Intel's response to COVID-19 and the importance of 5G and AI for pandemics COVID-19. Next slide. Intel is committed to accelerating access to technology that can combat the current pandemic and enable scientific discovery that better prepares and enables society for future crises. In addition to $10 million in donations for global COVID-19 relief efforts, Intel commits $50 million with pandemic response technology to initiative to combat coronavirus. Next slide. Our world is facing challenges unlike any we have seen before. The urgent need for action on issues like climate change, the deep digital divide, lack of inclusion, and global pandemics calls for a new era of shared responsibility. Therefore, we launched 2030 goals to create technology that enrich the lives of every person on Earth for a more responsible, inclusive, and sustainable world enabled through technology and our collective actions. One of our goals is to work with others to accelerate the cures for disease, improve healthcare access and affordability, and build smarter, safer workplaces. Our pandemic response technology initiative, for example, aims to improve the diagnosis and treatment of COVID-19. Next slide. COVID-19 clearly shows the importance of high-speed broadband infrastructure and connectivity. 5G and Wi-Fi are two complementary technologies. There is a massive increase in Wi-Fi use and the need for sufficient Wi-Fi spectrum. Therefore, it is important to consider the Wi-Fi 6 next generation Wi-Fi new technology at 6 GHz band like the USA, Brazil, Korea, UK. We need high-speed, high-quality broadband for different e-services and economic recovery. 5G can meet the requirements for new innovative health applications. 826 million students kept out of the classroom by the COVID-19 and they do not have access to a household computer and 43% have no internet at home. Most importantly, we need high-speed broadband for staying at home healthy during pandemics. Next slide, please. This slide provides information from United States related with the COVID-19 and the 5G Wi-Fi. FCC provided additional spectrum temporarily available for operators to meet the demand for broadband. The COVID-19 telehealth program provides $200 million in funding to help healthcare providers. San Diego's mayor and Verizon launched the citywide expansion of next generation 5G network. FCC's Keep Americans Connected pledge in order to ensure that Americans do not lose their broadband or telephone connectivity. FCC adopted rules that make 1.2 megahertz of spectrum in the 6 GHz band available for Wi-Fi unlicensed use. COVID-19 has demonstrated the importance of Wi-Fi system for staying at home. Next slide. You can see 4 of different applications implemented in Italy by Vodafone at health event last year. 5G connected ambulance is allowing medical staff to be continuously connected to the emergency management center and with the hospital doctors, providing a way to share the patient's vitals and the symptoms. A remote surgery operation was carried out for the first time in Italy on new 5G network in collaboration with the Italian Institute of Technology and the Hospital San Raffaele. With the data on the go, by using the 5G, technicians and the doctors are able to work together from different locations during the after radiological examinations. And if you look to the healthcare to home care, using the 5G and IoT, vulnerable patients such as those with heart disease can have their data gathered using continuously active wearable sensors, and this data is sent to a system that uses artificial intelligence to monitor the patient's health in real time. Next slide, please. This slide from Thailand. 2 applications by AIS mobile operator in Thailand. 5G robot has been delivered to many hospitals by AIS for COVID-19. The robot is qualified for taking care and monitoring the symptoms in patient room, alternative of doctors and the nurses. And the AIS and the Central Board Shopping Store and the complex have jointly implemented 5G control robots to ensure shoppers' hygiene and the safety at the department store. Next slide, please. In this slide, you can see 5G applications helping China to fight against the COVID-19. These applications include 5G-based telemedicine at different hospitals for remote diagnosis treatment services, and the CT, computerized tomography and the X-ray coordination solution based on 5G, information sent via 5G networks, including the ECG monitoring data and ultrasonic image, 5G cloud-based intelligent robots, 5G infrared temperature measurement to monitor the condition of passengers, 5G-based remote education. And it is also important to see the sector distribution of 5G application during the COVID-19 at the right side in the figure. As you can see, medical care application is leading, has the biggest portion. I have completed the first part of our presentation, and now Mario will continue with AI, artificial intelligence slide. Mario, it's your turn to speak. Thank you.
Thank you very much, Turan. Thank you, ITU. Next slide, please. And I will talk about artificial intelligence. Thank you very much. This is actually an image from the OECD, which I find is very interesting and very condensed in what it transmits. So as you can imagine, the possibility of using AI for the pandemics is very broad and across several stages of how addressing the disease. Looking at the research, for instance, AI can help accelerate the research on treatments by rapidly analyzing large volumes of data. Looking at detection, diagnosis, and prevention. On detection, quite interestingly, it is reported that the first entity that actually caught the outbreak of the pandemic would have been a Canadian startup called Blue Dot, that by using AI and machine learning and looking at the patterns of many types of data, caught that something was happening in Wuhan. In diagnosis, we'll see in the next few slides a few examples. So on prevention, it's clearly the prediction and trace the infection chain to limit further contagions. And the contact tracing apps are some examples of those. If we look into the response and recovery, you know, with the number of questions that the citizens around the world have about the disease, the symptoms, the way to address and the way to interact with the healthcare systems in their respective countries. So uses of virtual assistants and chatbots are extremely useful to take up some of the upload on the human operators. On a completely different vein, autonomous cleaning robots to disinfect the hospital premises are also very important. And I'll take an example on that one. But besides these specific, very good facts and examples, the OECD actually issues a few recommendations that I think that are incredibly important. So one of those areas are to encourage the multidisciplinary and multi-stakeholder cooperation and data exchange, both nationally and internationally. And why? Because the outputs are only as good as the training data. So AI works on data, and if the data is not good or available, it cannot actually work. The other key recommendation that I think it's to deploy it responsibly, enabling research without jeopardizing privacy. This was already mentioned. The next slide, please. I'll go very briefly through a few examples. The first one on China that uses AI based on 400 confirmed coronavirus cases, CT imaging, to help doctors on the screening system as well as to supplement the standard lab testing. So this really helped at the beginning, and it has been rolled out in about 20 hospitals. The second one comes from Ireland, from a startup. It's a prototype of actually an autonomous robot that, as you can see the image, circles around the hospital area, and by beaming UV rays, it looks to disinfect the premises without actually knocking on the people and throwing the beams to the people. And the next slide, please. An example, actually two examples from Korea, one of the countries that really use digital health and ICT and high performance computing to address the virus. Similarly to the Chinese example, also AI for medical imaging analysis, using chest X-ray data to detect pneumonia, which is one of the findings that are related with the COVID-19. At the beginning, there were obviously no testing kits to discover the disease. And so one biotech company in Korea as well, using AI and high performance computing, managed to reduce the time to develop the new testing kit from several months to around 2 weeks. So this is really extraordinary. The next slide, please. And this is my final slide. And in a way, it's also incredibly important. As I said about the importance of data, if there is one thing that the pandemic really showed us, it is the importance of access to data. And access to data can really increase the efficacy of technologies being used to fight the virus in several ways, as we have seen, tracking the speed, monitoring the availability of hospital resources. And the pandemic has really shown how important it is to have the data, but without compromising patients' privacy. And this is really a challenge. It's a clear challenge. So looking at Europe, as the first coronavirus cases actually were identified in this continent, the European Commission published the European Strategy for Data. It was already foreseen to do so, but one important aspect on that strategy is the creation of European health data space. The aim is to foster the exchange and sharing of different kinds of health data, like electronic health records, genomics, registries, etc. And the goal is to support the delivery of primary care, as well as the use of data for secondary care, such as the development of new treatments, medicines, medical devices, and services. This is really a key initiative because the world, all of us, are actually losing much of the potential from health data because of reduced access to that same health data. So we have an opportunity here to enable the right policy steps to increase access to health data and enable AI and 5G for healthcare, having privacy in mind clearly. So we don't know where the pandemic will end, hopefully as soon as possible, but I think that we should know and we should really consider to use the advantage of digital health to improve our lives. And thank you very much. This is all from our side.
Thank you very much both for Moulouk and Mario for very rich presentation, actually covering really the connectivity under 5G and the new frontier technology, AI and big data. And I think we all acknowledge that there are huge potential. And I think that probably this will trigger a lot of questions actually from participants, you know, on how to scale up, you know, what are the costs associated with those types of initiatives, how and to what extent those types of initiatives are relevant to you know, low resource settings or maybe countries who have not yet a mature ecosystem, etc. So I'm sure that, you know, many of those questions are probably in the head of many of the participants, and that's why I'm really encouraging all of participants to put your questions on the chat, comments, questions, and we will monitor your questions in the chat, and then maybe at the end we're gonna have our question and answer session, and we're gonna try to pick, you know, common questions or questions that are relevant to more than one presentation. Also, I would like to mention that those presentation will indeed be shared, maybe with the exception of only one presentation that we will not be able to share for copyright issues. But the others we will be able to share on the study group website. So I'm kindly asking the study group coordinator to provide the link in the chat for the web page where those presentations will be shared, so everyone can benefit from the information and discussion. So I'm sure Moulouk and Mario will come back to you hopefully soon with some questions. But now I would like to move to another presentation from Japan from Mr. Hirokazu Tashiro, who is the senior expert at, again, around the use of AI, particularly on analyzing the medical images from a use case in India. So Mr. Tashiro, you have the floor, please. Presentation, and I think it kind of responded to some extent to my previous question, to what extent those solutions are you know, practical and realistic to do in countries like India. And I think the example that you showed is a very concrete example, you know, how you can, with very limited investment, you know, really help and strengthen health systems on the periphery and really allow for rapid diagnosis in areas where you don't have specialists available. And I really liked also the fact that you have compared the results from your training of the AI models with you know, the normal diagnosis done by radiologists, and you saw that there are very kind of they match in terms of accuracy. So that's also very, very promising. And what is amazing is that with the same solution you can detect more than one you know, disease, whether it's TB or COVID or other things. So and this is the power of AI, that you can, you know, your model can really cover a number of issues and a number of illnesses that could be detected and diagnosed rapidly, or at least screened in a very cost-efficient manner. I see also that there are some good insights on the chat. So thanks for all of you. Thanks, Mr. Ganesh, for sharing a kind of a similar solution, and thanks for putting the link for a similar X-ray images solution that could be also used for diagnosis. And I think this is exactly the type of insights that we would like to get from you. I see that there are some questions around the 5G, etc., which we are going to monitor. So again, I'm encouraging you to continue to put your question on the chat, and maybe we're gonna take a third presentation, and maybe we can do like a small, let's say, stop to take some questions. And then we can proceed with the remaining of the presentations. So now we are going to move to a kind of a completely different area that for many reasons has not been very much on the radar screen, or at least is very much underestimated, which is the issues around mental health. I was very much surprised to personally to see the statistics around the number of suicide and trial of suicide that has been, the result of the confinement and the pandemic. And definitely this is an area that is extremely important, and people might go into this, depression or mental stress without noticing. And I think many of us and maybe our colleagues has gone through this maybe at different degrees. So I'm very pleased to invite Dr. Marina Jordanova, Associate Professor at the Bulgarian Academy of Science from Bulgaria, to kind of share with us their expertise and their experience and projects around the use of digital health for mental health in the COVID-19 pandemic. Thank you. Dr. Jordanova, you have the floor, please. Thank you.
Yeah. Hi, everybody, and thank you for participating in this webinar, and thanks to ITU for organizing it. So, as Hani said, we are moving to a total different area. This is the area of mental health. Next slide, please. And Veronique, your internet connection is unstable. Okay. So I would like first to remind you, at least to those who can't remember, what is mental health. This is the state of well-being in which every individual is able to realize his or her own potential, can cope with normal stress of life, can work productively, and is able to contribute to his community. The importance of mental health is such that it's part of the definition of health as is stated in the WHO Constitution. And it is citing, health is the state of complete physical, mental, and social well-being, not only merely the absence of disease. Mental health disorders are many and vary. Next slide, please. From anxiety and depression to such serious illnesses as schizophrenia and bipolar disorders. The main problem with them is that part of them are becoming chronic and may have a long lasting or lifetime disease. Some facts, you may read them from the slides, just two or three of them to underline. Almost 15% of the population in some aspect of their life have one or more mental or substance use disorder. Children at the age of 14 or below are extremely vulnerable, and about half of the mental disorders provoked at that time. Suicide is an extreme but very common outcome for people with untreated or badly treated mental disorders. And it's necessary to remember that although that the data are very underestimated, that every 40 seconds, one person ends his life with a suicide. And despite of this, the budget for treating mental health is less than 2% of the total health budget. And the human resources for treatment of mental health are very scarce and unevenly distributed. Next slide, please. Next slide. Okay, so during the last several months, we have a new situation, a pandemic, and as a result, new rules all over the world. Social distance, isolation, working from home, worries about personal health, panic of job loss, all these on the top of the news that overcome us from the media, put the mental health of all of us, not only from people with mental health disorders, in a great pressure. Next slide, please. So the result is that in this extreme situation, the mental health of the general population is deteriorating. There are enough already studies showing that the mental health, not only of the patients with pre-existing mental health problems, is deteriorating, not only of patients with COVID showed symptoms of mental health, not only the healthcare workers on the front line experience anxiety and depression, but the general population, even children that are stopped from school, demonstrated anxiety and depressive symptoms. And here I have cited some relatively big studies. That means relatively in medicine means that the participants of the study are at least several hundred or 1,000 and a half. So the statistic is good, and more statistic is coming. Next slide, please. So in this extreme and new situation, we have to turn back to the old and already forgotten decisions. I'm underlying forgotten that for most of you, probably it's somewhere in your memory, in the cell of your memory, that internet has started, and the first telemedicine services that were used are the telepsychiatric treatment of prisoners. This was the first in combination with the service for the astronauts and cosmonauts. These are the first telemedicine services that were on a relatively big scale developed. Necessary experience to use internet and information and communication technologies to treat mental health. We have a lot of experience supporting expeditions, supporting big ground-based psychosocial isolation experiments, as those that are demonstrating flight to Mars with 500 days social isolation with prisoners. So it's now necessary to turn back to what we have known and make it a large-scale application. Next slide, please. It's necessary also to underline that at the moment the COVID pandemic started, the mental health workers had responded, and the response was in 3 different channels. The first was from the international organizations and mental health organizations in countries and in hospitals, and these were written materials that were available for free in most cases as rules for protection, for prevention, but more useful were all online helping lines and consultation services that were immediately organized by national or community mental health organizations or psychiatric or psychological societies, trying to provide as much as possible online consultations, some of them for free, some of them paid, to support the general public. And of course, the third source were a lot of educational materials, both for medical staff and for general public. Next slide, please. Next. Now, after the several months of the pandemic, we have to draw the line and see what we have learned so far. We have remembered that the technology is available. We have once again proven that it is working. It's clear that the mental health workers are ready to react and support the community during the pandemic. But it's necessary also to underline that the clinics are taking care for the patients, for their families. They reorganized the way they are taking care for chronic patients. They adjust the medication. But the hospital staff is not able to be responsible for the general public, for all the borderline cases, for the teenagers and all the other vulnerable groups. So the prevention is something that is missing. Next slide, please. What are the challenges? Because we are talking that it's necessary to put the challenges. The main challenge for the future, because let's not close our eyes, this is not the only pandemic that, first, the pandemic hasn't yet ended. Maybe there will be a second wave, nobody knows, but this will not be the only pandemic during our lifestyle. During the existence of which we have to develop and promote virtual mental health support widely, not only for a given community, not only for a small group or for the big cities, but everywhere. The main problem and the main challenge will be, and is even at the moment, that all this virtual psychological and psychiatric support and yeah, I will increase the sound. And psychiatric counseling, they are not covered by the insurance policies in most of the countries. So we can't expect for the future, if the pandemic continues or if there is a new wave, that mental health workers will continue to work for free. In addition, there are a lot of other challenges to be solved. The first are the regulations, local and cross-border regulation. The problem is that, for example, in the European Union, there are some regulations allowing a cross-border medical care. But let's not forget that the medical care is geographically restricted. The medical doctor, the psychologist has a license to work in one country. So this is, the regulations are very important topic that have to be overcome if we would like to have a wide mental health support virtual for everybody. In addition, you all know the problems with standardization, the quality of care, and also there is something that has to be made clear not only for the experts, but for the general public, that the face-to-face contact can't be substituted by the virtual care, because there is a difference in the way you perceive and you understand your patient when you see the body language, the gestures, and things like that. And of course, you know, the social stigma, the cultural differences are important. So copycat approach in the mental health care is not the best solution. I have shown some graphics of our study done before the pandemic. It shows that people are ready to receive mental health support via internet. They prefer the second graphic, mail exchange of information, mainly because they have the ability to read, the possibility to read and reread again and again the instruction, the advices. At the same time, younger people are more eager to use this kind of how to say, support, and not all people are satisfied from what they receive, because this is a very big question. This is the transfer expectations and the false expectation. This is a big challenge that has to be also discussed with the public. Next slide, please. May I have the next slide? Okay, so, yeah, one of the main challenge that we will meet in the next several months is the suicide prevention. And this is something that we have to be ready to fight. The reason is that there will be an economic crisis, and above of the pandemic, the loss and the fear of potential loss of jobs will lead to, from all expectations and according to all colleagues from the World Psychiatric Associations, or at least for most of the colleagues, to a rise of the suicide cases. So all of us, the society, the community, the individuals, may do their best to prevent and, well, give their contribution to preventing the acceleration of suicide incidents. Next slide, please. So what is next? What we can do as a study group, as an ITU members. First, my hunch is that we have to raise the awareness of healthcare professionals, of decision makers, of donors about the, it's also, yeah, someone is Hideo Imaki. How do you care, just a second, how do you have mental health workers? In the same way, answer immediately, in the same way as you care for the general public. The main thing is to find someone to support you, to advise you, to give psychological consultations or even psychiatric consultation. And there are, of course, several ways to measure the level of anxiety, and if needed, it's not a shame even to use some medication. So back to the slides, it's necessary to distribute information, but not just an information, very concrete. What is available, where is available, how to do it, what is the cost? Because the effectiveness and the cost are sometimes the main stoppers for implementing given kind of services. And again, it's necessary to put the stress on prevention. It's necessary to support the healthy citizens because they are under pressure, and it's always better to try and prevent something or cope with the mild case of anxiety than to treat depression that may last for a year and a half. And I would like to underline that our study group 2.2 is not the first time that is dealing with this problem. In our previous reports, we have focused our attention on telepsychology, on telepsychiatric care, have shown successful cases in some developing countries, and I really believe that we may give additional impact on this and additional information to people how and what to do easily for the benefit of citizens, for the benefit of all of us. Thank you very much.
Thank you very much, Dr. Jordanova, for really shedding the light, on this very, very important area that, as we mentioned, is in some cases is underestimated. And I really like the way you presented. And also, I think I heard the good news that maybe the COVID situation, the unfortunate COVID situation, has forced or pushed a little bit the limit, and many people are now open and ready to engage in mental health, using those remote digital tools. What is good about this area of intervention, that the technology is there. Actually, the technology is quite simple. It's just, simple emailing, social media, web conferencing, all the technology is there already. I think what is still missing is this change of mindset, change of culture, having an environment that is ready with all the regulations. I think you touched upon also issues about reimbursement, that it becomes like a kind of a paid service. It's not done on only charity basis. So there are a lot of environmental, and enabling environment type of issues that needs to be addressed. So I really thank you for this very, very, important and insightful presentation. And I see some also notes on the chat to provide some additional information using telemedicine and digital health for mental health and telepsychiatry, etc. Maybe I'd like to take maybe a few minutes just to allow for some questions from the floor, and I've noted a very important question, and maybe would be addressed to the three of you and the three previous speakers. It's really about the question, that Mr. David Lafontaine asked. That he's saying that, of course, it's 5G can bring a lot of capabilities, and it's reasonable to think that the best for 5G is yet to come. However, all those promises must be supported by economic and financial structures and systems that are inadequate in many countries, even in some developed countries. I think the example, for instance, that you mentioned about that you had to train your model, it necessitates that you have the images and the data where you can train your model. And if this data is not available and it's not standardized and it's not organized, and you don't have all the regulatory and privacy protection and data security regulations that protects the people from using the data, those innovations will not be possible. So I would like to maybe ask the three of you if you can maybe share some insights about how do you think, what are the key recommendations that you would think are needful for countries to be able to leverage all those technologies and opportunities that are opened by 5G, AI, etc. In a nutshell. And if you can also maybe bring some concrete examples, of how a country managed to solve this in India, for example. How do they do it? And so the question is how to make it happen, actually, how we can leverage these types of capabilities. So maybe, I don't know if someone from Intel, or Dr. Jordanova, or the previous speaker on AI would like to take the floor. Mr. Tashiro, if you would like to take the floor to provide some answers.
Hani, if you like, I can start with my view.
Sure.
This is Turan. Okay, thank you. First of all, I have noticed there was a question from Dr. Mazar. And regarding the Dr. Mazar question, telemedicine, remote diagnosis, and treatment surgery with 5G can help to the shortage of the doctors and the medical gap between the rural and urban areas, and the rural people or developing countries, people living in the developing countries, people can benefit from the even best medical doctors in urban areas or in other developed countries. Regarding the question of David related to the 5G, how can we happen, and also other technologies. And the digital transformation, if you look, digital transformation is a top priority subject, and the digital economy also in many countries. And developing countries have already invested billions of US dollars for the existing mobile networks, 3G, 4G. This includes the base stations, towers, and the fiber backbones. And 5G will be based on this existing investment and the existing networks. We need this existing investment for the 5G. I am just trying to say the most costly part of the mobile networks, the developing countries have already invested for them. For the last point is that the digital transformation will provide and will reduce the cost of developing countries and will provide new opportunities for new revenues. In fact, therefore, all the countries are trying to realize the digital transformation for the digital economy. And for the realization of the success of the AI or 5G or other new technologies, according to my experience, first of all, the coordination between Ministry of ICT and the Ministry of Health is very important. Digitization of e-health applications and services and providing the finance for these services is important. Introduction of new technologies such as 5G AI is important. Developing countries can benefit from the experience of other countries today we share. They may also consider to start with the pilot applications, new technologies helping to reduce the cost of such as remote diagnosis and the treatment surgery we mentioned about, and the digitization of e-health services will also help to reduce the cost and ensure the modernization of the classical health systems with new technologies, and the digital services will reduce the existing cost and provide additional resources. Thank you.
Thank you, Mr. Thank you very much, Mr. Muluk. Mr. Tashiro, I mean, from your experience in this project that you have in India with this mobile unit, to provide radiology and AI screening, how did you manage, to get all the regular type of challenges in terms of business model to make it like a profitable service, to make it sustainable? How did you build the capacities? How did you, train the model? How did you get the data? How you overcome all the regulatory aspects? If you can maybe share with us some insights that can, countries can learn from. You are muted, so you can unmute yourself if you'd like to speak.
Hello, can you hear me?
Yes, go ahead.
Actually, to be honest, I don't know all, but what I know is that for the combining with the existing medical system is important, and also the working together with the doctor and radiologist is very important for keeping accuracy. So those that working with existing power, existing technology is the important for using the new technology.
So that solution are not seen as, pushed from top down, but they are really kind of bottom up. They are really made and designed and deployed with the end user to make sure that there is enough level of adoption, and there is also demand those types of services, maybe.
Yeah.
Okay, great. Dr. Jordanova, you might know that in Germany, they have finally solved this issue of reimbursement of digital health application. And actually there is a webinar, even a conference that is running in Germany in September, where they are going to share how they managed to solve this issue of reimbursement, which is a composite problem, because if you want to reimburse, you need to also first kind of certify solutions and make sure that the doctors are well equipped, etc. So there are a lot of things that needs to happen before you can reimburse a digital health. My question for you, don't you think that with the COVID situation, there is more openness now to consider all those actions? Do you have examples of countries, or maybe in your own country, who have now started to look seriously at those environmental issues, and which is very relevant to the mental health, because we all know that it needs a change of the mindset, it needs a change of the practice, it needs to be part of the medical practice, it needs to be reimbursed, etc. Is there any openness now to scale up digital health because of COVID? Can you see some examples that you can share with us?
Yes, there is a little bit more discussion on this. But between discussion and realization of the things, there is a long way. And I would like to focus on something a little bit on the side, that it's necessary not only to change the mind of the decision makers, it's also necessary to change the minds of the medical health providers and of the population. What I mean talking about medical health providers, we have the following problem with colleagues providing psychological consultations. It's necessary to prove them, and we have done this with studies, that as far as they are not reimbursed by the government or by the insurance, they are afraid that widely available virtual consultations or support will hit their financial income. But there are a lot of studies showing that this is not true, because first, we are more than 7 billion on the earth. So there are enough people to go to every psychologist, psychiatrist, to every clinic. Plus, usually people, especially for mental health, that are seeking support, that they are either shy, they will not go directly face-to-face consultation. Most of them need this as a first step, first to admit in front of themselves and their families that there is a problem. And while using this channel, first we may reach most of the vulnerable, we may reach lonely elderly people, we may reach people that have problems in the family, but will never talk in front of the others. And after that, there are enough studies showing that once there is enough such kind of virtual remote consultations and support, part of these people will go to the specialist for face-to-face treatment. So the medical health workers must not be afraid and must not try to reject or not be so careful about implementing such kind of sources. Also, from the other hand, is the general public, the people, all of us. We have to know what are the limits, what kind of, this is something like educating the citizens. We have to explain people, and this is our role, that going and using such kind of consultations, they're not going to the church to confess. the virtual mental health worker or consultation is not a priest. He will not give you a magical pill and prescribe it, because many people need it. Just a pill, magic, end of the question. So this is a lot of education. Yes, there are talking at the societies, but as you see in Germany, it's a white bird. It's not so widely available, and we need to start and do our best. What will be the result? Maybe the second wave hit us, we'll finally realize that we have to speed up. Oh, sorry.
Okay, thank you very much. It's so inspiring and interesting that we can continue forever. So maybe let me now move to our next presentation from Professor Nakajima, who is a professor in Seisa University in Japan, and he's going to share with us an insights learned from previous pandemics around drug distribution and prevention, and how this potentially can be used in similar pandemics like COVID. So Professor Nakajima, you have the floor, please.
Yes. Hello, Mr. Hani and the participants. I'm a co-reporter of question 2/2, e-health of ITUD. Today, I would like to introduce some new concept related to pandemic. Slide 2, please. Definition. The definition of targeted antiviral prophylaxis is providing medicine in advance to citizens who are predicted to become disease, or administering to patients, even if medical verification, for example, PCR test, cannot be obtained. Slide, please. Slide, please. It will be performed just before the outbreak of the pandemic. This is a definition of TAP. Next slide. Next slide, please. In case of Japan, we have a history of deployed medicine, handing over medicine in advance. Since 1706, era of samurai, Toyama, located near Kanazawa facing Japanese Sea, merchants have been developing the business model of handing over medicines in advance throughout Japan. Toyama patent medicine business is a Japanese representative local industry which has grown up by door-to-door visits under the management principle of value first, money later. Slide, please. I would like to introduce the case of Fukushima nuclear power plant accident, issue of iodine preparation to prevent from thyroid damage. Local government has distributed to people under 40 beforehand and called for them to take as a high level of exposure. This is a deploy medicine based on targeted prophylaxis policy, during major disaster. Next slide, please. I'd like also introduce the case of the last pandemic, 2009 swine influenza H1N1. It was introduced on trial basis in some city in UK, England. It is a system that citizens apply medicine in advance by internet and come to city hall to get medicine, such as Tamiflu. There is no face-to-face consultation between physician and patient. If patient is anxious, browse the website for drug information. Taking medicine is at patient's own description. If patient was worried, contact medical personnel by the internet or mobile phone. That is a telemedicine. Next slide, please. Merit of TAP, targeted antiviral prophylaxis, Merit 1. Medication can be provided to many citizens. Reduce the risk of infection of medical staff. Knowledge of medicine is obtained before taking. And demerit. There might be chance to become shutdown of website, e-pharmacy, due to communication traffic congestion. 2. There might be case that the citizen has take a drug uninfected condition. 3. There is a risk to transfer or sell drugs. We know there is some risk in disaster medicine because it seeks the maximum effect of the general public. However, people with disability and young people must be considered. Next slide, please, the last one. What telecom operators should keep in mind? Securing the number of operating lines. Line administrators will be also infected. Second, set up many mirror sites about e-pharmacy to prevent traffic congestion. 3. Full coordination with the medical side. Officials who think that no country will issue unprecedented administrative guidance should reconsider. This pandemic is a disaster we haven't experienced since the Spanish flu of 1918. Therefore, you should be aware that your common sense may not always apply. Please keep the word targeted antiviral prophylaxis, TAP, in your knowledge. Thank you very much for your attention.
Thank you very much. Thank you very much, Professor Nakajima, for this insightful presentation. And I understand that this might be piloted in Japan. So I think it would be extremely interesting to see the results of such an approach, as you have done with the previous pandemics around bird flu or other types of pandemics. Now I would like to move to our last but not least at all presentation from Mr. Sakano, who is the CEO and founder of ALM Inc. from Japan. He's going to share with us the company's developed medical ICT platform that is used for stroke management and also COVID-19. So Mr. Sakano, you have the floor, please.
Okay. Hello, everyone. Great. Thanks for your time and the opportunity. Thank you, ITU, for organizing this. I am a CEO and the founder of a medical IT startup from Japan. I will be presenting 2 ICT solutions dealing with COVID-19. Next slide, please. One is doctor-to-doctor telemedicine platform. Next slide, please. Another one is patient monitoring platform. Next slide, please. We are providing doctor-to-doctor telemedicine platform, which we have been focusing on stroke, which is, according to WHO, #1 cause of human death. Next slide, please. This is how it looks like. It's a mobile app giving access to medical data such as CTs and MRI images, sharing those data to stroke experts, and consultation between doctors to make quick decisions. Basic functions are push notifications for new cases and updating patient conditions, chatting interface, video calls, and viewers for medical images, ECGs, EEGs, any medical records. More or less like WhatsApp, focusing on medical usage. Next slide, please. The concept is anywhere and anytime, supporting dealing with time-sensitive diseases such as stroke, which each minute counts. Next slide, please. A group of doctors can be within a hospital for specific case or topics, can be regional network or can be nationwide network. Next slide, please. You can create groups among each topics, disease, or any cases. Next slide, please. And groups and topics started with stroke, but has expanded to other ologies such as trauma and oncology. One of the major new topics being discussed is infection, of course, mainly COVID-19. Next slide, please. Yes, we are dealing extremely sensitive data and privacy, security, FDA issues, and many regulations are being involved. This app is approved in Japan, United States, European, Brazil, and many other nations now. Next slide, please. We are now providing a platform in 21 countries with all regulations clarified, over 80 medical university hospitals connected, operating many public regional medical networks focusing on acute disease, and SDGs projects supported by Minister of Internal Affairs and Communications of Japan. Next slide, please. Of course, regarding regional medical network, infection has been our new target. We cannot avoid this topic now. Next slide, please. From 82 medical university hospitals in Japan, 48 of them have adopted our platform, and many COVID-19 cases are discussed daily. Next slide, please. You can click on the image, please. As a platform provider, we are now providing teaching files for doctors and training data for AIs. This is a very fast case from Japan. As you can see, a typical image of CT of COVID-19, severe condition with respiratory device on. This was taken 3 days after onset. And this is another image from the same patient. This was taken 6 days after the onset with ECMO on. He died 2 days after. Now we are gathering data from 8 countries. Next slide, please. So we are, next slide, please. Yes, we are providing data for free. Concept is how quickly we can provide data needed for clinicians and anybody involved to make things better. For COVID-19, and any, of course, upcoming new pandemics. Next slide, please. Now, not simply as a mobile app provider, we have been integrating with many solution providers globally, such as Image AI tech company. This is one is an AI tech company from Brazil, providing suspected disease by percentage. Beauty is there supporting simple X-ray AI diagnosis, and not for expensive CTs and MRIs, and charging only 50 cents per image. Of course, so things need to be affordable. Next slide, please. Also, if you need a diagnosis report by a radiologist, we have integrated with teleradiology centers in the United States, Japan, and Brazil. Experts are providing reports within 2 hours for $5 USD. Again, things need to be cost efficient for SDGs. Next slide, please. With support by Minister of Internal Affairs and Communications of Japan, we are providing education programs to train doctors, inviting them to Japan, and supporting to develop doctor-to-doctor telemedicine regional networks in your country. And Japanese experts are providing cross-border telemedicine 24/7. Next slide, please. So that was doctor-to-doctor telemedicine is one solution for COVID-19. Next slide, please. So another solution is patient monitoring platform. Next slide, please. Once again, we have been focusing on acute disease. Next slide, please. Now we are providing apps for patients and family members, giving access to medical data and consultation by specialists. You can call for emergency with precise locations and conditions, which helps specialists to decide your case. Next slide, please. Now we are providing interface to keep track of your vitals and symptoms such as body temperature and blood pressure. Next slide, please. Idea is how to make infected patients to stay at home if they are not facing severe case. As we know, there are many cases with COVID-19, patients become severe instantly. This is an interface to consult with home doctor and public sectors involved in the decision making. Next slide, please. This is an interface to monitor each patient staying at home with all vitals and symptoms for home doctors and public sectors to decide each case. Next slide, please. Another integration we have done with a tech startup from Israel is image processing AI with smartphone camera measuring SpO2 and respiratory rate, not using any device. SpO2 and respiratory rate are major indicators for up and coming severe conditions for COVID-19 patients. So next slide, please. These are our two ICT solutions for COVID-19. Thank you for your time.
Thank you very much, Mr. Taipei, for your very, again, insightful presentation. And I really like the fact that you have also integrated your kind of classical telemedicine solution with, you know, AI, even with other startups, whether for, you know, imaging diagnosis or even for, you know, detecting respiratory diseases. So I think it's extremely insightful. I think our time is closing now, but I would like to highlight, you know, some of the great comments that we are getting on the chat. I think there is a wealth of information that some people, including Mr. Ganesh, is putting on the chat. I really like the fact that you are sharing the new telemedicine guidelines that India has put, you know, at the start of the COVID-19, which helped a lot, you know, the deployment of telemedicine applications like the one that we just saw now in India. So I think this is a lot of lessons learned, and definitely many of those are kind of replicable to some extent in other countries. So I kind of urge you to, or encourage you to look at those telemedicine practice guidelines that has been issued in India in March 25th, 2020. Also, there has been another question about the use of, you know, how we can cater to people with disabilities in the telehealth and digital health applications. And in that sense, our accessibility division and the our teams who are working on these types of topics are indeed working on some guidelines for telehealth and digital health applications on how you integrate guidance when it comes to people with disability. It's called accessibility guidelines for telehealth and digital health application. So for those who are interested to get a little bit more insights, this is something that our team is doing with WHO. We can definitely share information with you. There are other very also useful information, you know, particularly from UNCTAD about the, you know, the guidelines and report they have done for consumer protection during COVID using digital health services. Again, that seems also to be something that is extremely needed and has been mentioned several times. Anyway, we are going to also compile all the comments that are in the chat. We are going to order them a little bit and also share them on the website and the web page that is being shared in the beginning of the chat, where you can find the access to those presentations. And you can, you know, don't hesitate also to come back to us if you need the, you know, additional information, or if you have other insights that you would like to share. Unfortunately, we have reached, or I think it was very, very rich webinar. Of course, it's not enough because the topic is quite wide, but we really think all our speakers for the time and effort that they have spent to share with us their experience. And great thanks also for you as participants for having followed up this webinar. The webinar also is recorded for those who would like to see it again. Also, you can write to us, to get access to all those materials. With that, I would like to maybe come to a conclusion of our webinar today. Thank you very much, and I hope that this webinar will help you to think more on how you deploy and scale up digital health for COVID, but also for health in general. And I do hope that the unfortunate COVID situation will help and kind of push the digitalization process in different sectors, including health. So thank you again, and have a very, very good end of day. Thank you, and bye-bye.